Did you know that mosquitoes are responsible for more deaths worldwide than any other animal, spreading diseases like malaria, dengue, and Zika? Hello, everyone. My name is Daniela, and together with my team, we will be discussing a fascinating and concerning topic: emerging infectious diseases and climate change, the rise of vector-borne threats. Representation will explore how the changing climate is fueling the rise of emerging diseases, particularly those transmitted by vectors like mosquitoes and ticks. Let's start with definitions. Climate change is the long-term alteration of temperature and weather patterns, primarily due to human activities such as burning fossil fuels. On the other hand, emerging diseases refer to infections that have recently appeared within a population or those whose incidence is rapidly increasing. When these two intersect, we get a dangerous recipe for diseases spreading to new regions and populations. What are vector-borne diseases? These diseases are transmitted by vectors, organisms like mosquitoes, ticks, or fleas that carry pathogens from one host to another. Climate change is increasing the spread of these diseases by creating favorable conditions for vectors in new regions.
So, climate change impacts our health in numerous ways, primarily by influencing the habitats of disease carrying organisms or the vectors, such as mosquitoes and ticks. As temperatures rise and rainfall patterns shift, these vectors find new, warmer regions that were previously uninhabitable for them. Climate change brings erratic weather patterns with shifts in rainfall and longer, hotter seasons. These conditions create favorable habitats for vector populations to thrive. In warm, humid environments, mosquitoes can breed more quickly, and ticks have shorter development cycles, which allows them to spread more rapidly. For instance, warmer winters allow ticks to survive in higher altitudes and latitudes, leading to the spread of Lyme disease into areas that were previously unaffected. Extreme weather events such as floods, droughts, and heat waves also play a role in disease transmission. Flooding, for example, creates standing water that serves as a breeding ground for mosquitoes. On the other hand, droughts may force people to store water, which, if left uncovered, also becomes a habitat for mosquito larvae. Climate change alters ecosystems, leading to biodiversity loss that disrupts predator-prey relationships. As natural predators decline, vectors like ticks and mosquitoes flourish, increasing the risk of diseases like Lyme disease and dengue. Biodiversity loss creates gaps in ecosystems, allowing disease-carrying vectors to thrive and spread more easily. One of the most pressing health issues emerging from climate change is the increased prevalence of vector-borne diseases. Dengue and Lyme disease are two prime examples that will show how climate change is driving disease patterns in new and troubling ways.
Dengue fever is a viral infection caused by RNA viruses from the flavivirus genus, mainly transmitted by Aedes aegypti and Aedes albopictus mosquitoes. Symptoms include high fever, severe headache, joint and muscle pain, rash, and bleeding tendencies. The incubation period is 4 to 7 days, with symptoms lasting 3 to 10 days. Dengue can range from mild fever to severe forms, including hemorrhage and shock. About 0.5 to 5% of cases develop into severe dengue, which can be transmitted through perinatal transmission, blood transfusions, breast milk, and organ transplantation. Treatment for mild cases involves acetaminophen and oral fluids. Severe cases require hospitalization, IV fluids, and sometimes blood transfusions for bleeding or unstable patients. Without treatment, severe dengue can have a mortality rate of 10% to 20%, but with proper care, it drops to about 1%. Dengue fever is the fastest spreading mosquito-borne viral disease in the world. Every year, it affects over 100 million people, and sadly, it leads to 20,000 to 25 deaths, with children being the most vulnerable. This disease is endemic in more than 100 countries, especially in tropical and subtropical regions of Asia, Africa, the Americas, and the Pacific. But here's the worrying part. Over the past few decades, we have seen dengue spread into new areas, including parts of Europe and North America. This is largely due to climate-related changes, like rising temperatures and more frequent rainfall, which create ideal conditions for mosquito breeding. As a result, the range of dengue is expanding, and public health systems worldwide are facing new challenges. Now let's focus on the environmental determinants that contribute to the emergence and transmission of dengue. Dengue is closely linked to the environment because the mosquitoes that transmit the virus thrive in warm, humid climates. Rising global temperatures and more frequent rainfall due to climate change create ideal breeding conditions for these mosquitoes. Stagnant water from heavy rains, for example, becomes a perfect habitat for mosquito larvae. Urbanization also plays a role. In rapidly growing cities, especially in tropical and subtropical regions, Poor waste management and lack of proper drainage systems lead to water pooling in containers, tires, and trash, providing even more breeding sites. Another critical factor is deforestation. When forests are cleared for agriculture or urban development, mosquitoes and humans come into closer contact, increasing the likelihood of disease transmission. Finally, climate variability like prolonged droughts followed by heavy rains can disrupt ecosystems, further enabling mosquito population to flourish. Now let's explore the social, economic, and public health burden that dengue places on society. First, the social burden. Dengue mostly affects lower middle and lower income countries, which often lack the resources to handle large outbreaks. These regions typically struggle with inadequate healthcare infrastructure, including limited access to medical staff, hospital beds, and essential medical supplies. This means that during outbreaks, hospitals can quickly become overwhelmed, making it difficult to provide the level of care that patients need. Next, the economic burden. The costs associated with dengue are substantial. The global costs of dengue were estimated at 39.3 billion in 2011, including the economic impact of healthcare utilization, loss of productivity, and premature death. On a household level, the impact is also significant. Households lose 11.2 to 11.7 days annually due to dengue-related illnesses, and symptomatic patients lose 7.2 to 8.8 workdays per infection. Now let's talk about the public health burden. Dengue outbreaks often occur alongside other infectious diseases such as influenza, malaria, and COVID-19, which share similar symptoms. This complicates diagnosis and treatment, making it harder to healthcare providers to differentiate between diseases. The ongoing threat of dengue means that public health systems must take sustained efforts to manage and prevent the disease. These efforts include continuous surveillance of dengue cases, research into the development of effective vaccines, and the implementation of vector control measures to reduce mosquito populations. Moving on, we will explore the strategies for dengue prevention and control. The primary focus is on controlling mosquito populations by eliminating breeding sites, using insecticides, and adopting biological methods like sterile mosquitoes. On an individual level, the use of repellents, protective clothing, and mosquito nets is essential to reduce the risk of bites. Community involvement plays a big role, with public health campaigns, school programs, and training for health workers being key measures. Surveillance systems and early warnings help monitor and prepare for outbreaks. Environmental management, such as improving waste disposal and drainage systems, further limits mosquito habitats. Efforts like vaccination programs such as Dengvaxia, alongside research into better vaccines and treatments, are also vital. On a global scale, international collaboration and travel advisories ensure coordinate action against dengue while protecting travelers. Together, these strategies create a comprehensive approach to combating the disease.
Lyme disease is caused by Borrelia burgdorferi, a pathogenic spirochete that primarily affects small mammals and birds. This bacteria does not cause disease in its natural host but becomes a problem when transmitted to humans through tick bites. While B. burgdorferi is the primary species responsible in North America, Europe sees additional species that often contribute to Lyme disease. The tick that plays a key role in the transmission is the black-legged tick. Early signs of Lyme disease often present 3 to 30 days after infection and include the characteristic erythema migrans rash, often described as a bullseye lesion, as you can see in the picture here. Other early symptoms may include a fever, headache, and fatigue. It's important to note that not all patients display this rash. If untreated, Lyme disease can progress to more severe stages. Symptoms may include additional rashes, pain, severe headaches, and neurological issues that impact thinking and reasoning. In some cases, symptoms can last months or even years, leading to chronic health issues. The incidence of Lyme disease is on the rise, particularly in North America and parts of Europe. In the United States, areas with the highest case numbers include the Northeast, Upper Midwest, and Pacific Coast. In Europe, the disease is rising in central and northern countries such as Germany, Sweden, and the Baltic states. This geographic distribution is being further influenced by climate change and human activity encroaching on tick habitats. To show the increase of incidence of Lyme disease, you can see the maps from 2001 and 2022 and just how many more cases there are in these areas of the United States. Climate change plays a crucial role in expanding the range of ticks as warmer temperatures and milder winters allow them to thrive in previously inhospitable regions. This shift increases the risk of Lyme disease in areas where ticks were once rare, thereby expanding human exposure. Additionally, longer tick seasons mean that individuals may face increased risk throughout the year.
Lyme disease, while treatable with antibiotics if caught early, can lead to long-term health complications if untreated. Post-treatment Lyme disease syndrome, or PTLDS, can cause persistent symptoms such as chronic fatigue, pain, and neurological issues. Severe cases can lead to arthritis, heart inflammation, and neurological disorders, which can significantly impact a person's quality of life. The economic burden of Lyme disease is considerable, with healthcare costs related to diagnosis, treatment, and management of chronic symptoms. Additionally, lost productivity due to illness and long-term disability further strains both individuals and healthcare systems. As for mitigation strategies, you can have public health interventions such as education and awareness. So, education plays a key role in preventing Lyme disease. Public health campaigns, such as the two posters that you see on the right, can teach individuals to avoid tick habitats, use repellents, and perform tick checks and significantly reduce the risk of transmission. Also, habitat management strategies such as landscaping to reduce tick habitats around homes and recreational areas are also important. Another mitigation strategy is surveillance and monitoring. So, surveillance systems are essential to track tick populations and Lyme disease incidents. Regular monitoring helps public health agencies understand where risks are highest and respond appropriately. In Canada, for example, significant increases in reported cases from 144 incidences in 2009 to over 3,100 cases in 2021 highlight the importance of effective tracking systems. So Lyme disease is an increasingly prevalent illness with significant public health and economic impacts, and as this disease spreads to new regions, it's crucial that we continue to monitor its progression, educate the public, and implement strategies to reduce exposure to ticks.
So, from an international health perspective, there is a resurgence of vector-borne diseases with more than half of the world's population at risk. Some of the current implications of an outbreak of vector-borne pathogens is that drug resistance is developing towards insecticide treatment. One common theme among organizations involved in the prevention, control, and management of vector-borne diseases is One Health. On this slide, there is an image portraying the concept of One Health by the CDC, which is based on an approach integrating the health of humans, animals, and ecosystems for the purposes of preventing and controlling diseases. It aims to address issues related to health through an interdisciplinary lens rather than isolation. This approach has been around since 1984, however, it has become more common since 2000. In 2021, WHO established One Health Initiative, which unites essential sectors. It's important to include components of our ecosystem when planning how to deal with the resurgence on such outbreaks because, for example, 60% of infectious diseases that are emerging globally are from animals. The One Health concept is applied. It promotes the objectives and targets of numerous sustainable developmental goals at the same time and can be applied to interventions for vector-borne diseases such as dengue and Lyme disease. Some examples are Goal 3, ensuring healthy lives and promoting the well-being for all at all ages intersects with Goal 13, taking urgent action to combat climate change and its impacts. In terms of Lyme disease, what can be effective is focusing on a target of Goal 13, such as the development of urban green spaces to counter the heat island effect, which is known to create new tick habitats, increasing the risk of contracting Lyme borreliosis. Goal 6, which is ensuring availability and sustainable management of water and sanitation for all by improving access to safe and affordable drinking water, removes the necessity for alternative water storage that are potential AIDS breeding sites. And Goal 11, making cities and human settlements inclusive, safe, resilient, and sustainable, and improving urban waste management will manage the amount of preventable breeding sites for mosquitoes as well as habitats for other vectors and. So the World Health Organization has multiple sub-organizations involved in the response to vector-borne diseases in regions such as the African region, East Mediterranean region, which are heavily impacted with disease burden and morbidity due to vector-borne diseases. Its most notable program is the Global Vector Control Response Program that has been active since 2017 and aims to reach its goals and targets by 2013, which I will get more into the next slide. The Pan American Health Organization is an agency of the United Nations in charge of international health in the Americas. Its mission and objectives are to enhance national capacities to implement effective prevention, treatment, and control programs that are economically sustainable. Global Vector Control Response Program includes a response framework based on 4 pillars of action, such as inter and intrasectoral action and collaboration, enhancing vector surveillance and evaluating interventions, and its goals focus on reduction of mortality targets by 2025 and 2030 to prevent epidemics by 2025, and its foundation relies on enhancing vector control capacity and capability by increasing research and. One thing to consider in interventions at a large scale is its evaluation on effectiveness. One way to measure effectiveness and to be accountable is through a circular policy approach introduced by Tarapi and Siotis. In order for nations to achieve the global vector control response targets, it's through incorporating evaluation and auditing after each full cycle of preventative and control actions. The rapid and unpredictable changes in vector-borne disease transmission requires nations to continuously assess and adjust their strategies. Failing to update policies and evaluate intervention outcomes could worsen disease spread and outbreaks. Not reevaluating and realigning the original policies with current needs and not assessing the success and outcomes of the interventions may prove detrimental to VBD transmission and outbreaks. In conclusion, the main driver of vector-borne diseases such as dengue and Lyme disease is climate change, due to factors such as deforestation, urbanization, and the change in rainfall patterns. This results in an increase in vector populations and it threatens human sustainability. With WHO predicting that nearly 80% of the population at risk, it is important to address these issues by using the One Health approach and integrating environment and animal health. The GVCR program is currently working with public health agencies, environmental agencies, and animal agencies to reduce the rise of vector-borne diseases. However, it's up to us as individuals to understand the role that we play in increasing its risk, as we are the cause of climate change and need to take responsibility on what we can do, such as educating ourselves on this topic.
Thank you for listening to our presentation. At the end of these slides, you will find some questions to help evaluate your understanding of the topic. Additionally, we will provide a handout with key information for your reference. We appreciate your attention and participation. Have a great evening.